Type 2 diabetes, adult onset, is a chronic condition that affects how the body processes blood sugar, glucose. The pancreas is responsible for the making and releasing insulin to stabilize blood sugar levels in our bodies. If the pancreas does not make enough, it can result in high blood sugar known as hyperglycemia. This is very dangerous because it can damage the nerves that lead to our organs and as well affect mobility. The symptoms of unmanaged type 2 diabetes, adult onset, are tiredness, excessive thirst, frequent urination, to wounds not healing properly. Other complications when blood vessels are damaged can result in kidney failure, fatty liver, as well as nonproliferative diabetic retinopathy, NPDR. NPDR is when fluid or blood leaks behind the eye, which if not managed or treated leads to blindness. A common unnoticed symptom of type 2 diabetes, adult onset, is diabetic neuropathy. This is where the blood vessels and nerves are damaged. There are four main common types of diabetic neuropathy. Peripheral neuropathy usually affects the legs and sometimes the hands. The symptoms of these are mild to severe. People with this usually have poor circulation, which makes it difficult for wounds to heal. Sometimes in extreme cases it can lead to amputation. Numbness, tingling or burning sensations, extreme sensitivity to touch, muscle weakness. Insensitivity to hot and cold temperatures, sharp pain or cramping, loss of balance or coordination. Autonomic neuropathy is the second type of symptom of neuropathy. The autonomic system runs and controls other systems in the body and has no conscious control. Digestive system. That is delayed, causes high and low blood sugars. Constipation, diarrhea, swallowing trouble. Gastroparesis, which causes the stomach to empty too slowly into the small intestines. Cardiovascular. Nerve damage causes our heart and blood pressure to respond more slowly. Profuse sweating, pain in the arm, back, neck, jaw, or stomach. Shortness of breath, nausea, lightheadedness. Proximal neuropathy is more common in adults above age 50 and often affects men more. Pain in buttocks, hips or thighs, muscle weakness to stand without assistance. May recover in a few years without treatment. Focal neuropathy damages one specific or group of nerves, causing weakness in the affected area. Appears suddenly and is painful, usually hands, legs, torso or head, can resolve in a few weeks. Pain, numbness, tingling in fingers, inability to focus, double vision or aching behind the eyes. Bell's palsy, pain in isolated areas of the body. Diabetic neuropathy is caused by continuous high blood sugar. Low levels of B12 or use of diabetes medication such as metformin can also cause neuropathy. The doctor may prescribe B12 injections. The risks of developing diabetes neuropathy increase with age as well the longer a person has diabetes. It affects 15 to 50% of adults with type 2 diabetes, adult onset, within 10 years of having it. Lifestyle choices such as smoking and alcohol may also contribute to diabetes neuropathy. Kidney disease, high blood pressure and cholesterol. People with high BMI can also develop diabetes neuropathy. Studies have shown genetics play a factor as well. Treating diabetic neuropathy can sometimes be controlled by lifestyle changes such as quitting smoking and drinking, low-carb diet and trans fat and added sugars. Diets such as fresh fruit with vegetables, nuts along with lean proteins such as chicken or plant-based may also help with nerve pain. Physical therapy such as light stretches, going for walks incorporated with moderate weight training and strengthening may also help. Different exercises and activities are used for people to ensure further nerve damage is not created. Doctors may also prescribe painkillers such as Tylenol with nerve pain. Nerve damage can't be replaced, but some of these treatments may help and prevent further damage. It's important to have diabetic neuropathy controlled because it can trigger other diseases such as depression and reduce quality of life such as sleep disorders. Recreational therapy assistants, gerontology, TRAs, can meet the needs of adults in residential care homes that have diabetic neuropathy include muscle resistance exercise with light weights or water bottles to help build strength. Light flexibility exercises and going for walks to help stimulate circulation and motion stiffness. Simple dance techniques to help with movement of all body parts. Preparing healthy meals together that help reduce symptoms of diabetic neuropathy. Each exercise and diet is tailored uniquely for each resident as diabetic neuropathy affects each individual differently. The TRAs creating programs such as these exercises and meals may reduce further nerve damage and promote nerve regeneration in some cases. It's always important the resident is happy to join in these programs, and if not, ask what they like and incorporate activities and exercises that are enjoyable. Fasting blood sugar. Normal blood glucose is 3.9. Diabetic blood glucose is 4.4 to 7.2. 2 hours after meal. Normal blood glucose is 7.8. Diabetic blood glucose is 10. Blood glucose monitors measure blood sugar in units of millimoles per liter. Even minor elevations in blood sugar can be harmful when left untreated. Here in Canada this is also the same. For update information please visit www.diabetes.ca. On the website it also has multiple resources from nutrition and fitness information to finding a health provider to help manage diabetes.